Hi, this is Bruce McCollum, President of Direct Care Training and Resource Center, and it is my pleasure now to take a few minutes to talk about 5 things that helped me to make a success of adult day healthcare. Adult day healthcare programs can effectively serve communities, and they do so all over the world. These wonderful programs are outlets for socialization, rehabilitation, nutritional and medication management, and family relief. I really enjoyed my time in the business. Right now, you might be looking at a younger me in the main activity area of our adult day program back in 1995. In that photo is also the late Mrs. Louise Moon. Do you know she was 94 years old when I met her? And she had sat in her apartment bathtub for 2 days, unable to get out, before her daughter found her in her apartment. That kind of experience, I bet, communicates to you why adult day programs that provide a level of supervision for those who suffer from dementia and physical frailty are real necessities in the healthcare spectrum. Now, once her daughter forced her to move in with her and her son-in-law, Miss Moon was enrolled in our program, in that way spending days alone and risking a reoccurrence of that horrible incident would be minimized. What I would like to give you today are 3 essential elements of developing and maintaining a quality program. Now, in the business development kit or manual that I've authored on this subject, which now has special supplements, I include more detailed and strategic marketing advice that I know you will benefit from. But first, let's do this. Let me tell you specifically what these 3 main points are. Number 1 is comprehensive program development. Number 2 is building layout. And number 3, serving special populations. Okay, let's get started. When I use the word program, I am trying to communicate that yours must be more than a place to sit and eat. A structured activity and medical follow-up program ensures that the needs of your program participants are always met, and that you have programmatic mechanisms in place to respond to their varying and sometimes changing needs. So the program has to be person-centered. Here's what I mean. Because if you do it right, your program could also be a specialty program and therefore attract a certain population. For example, some adult day healthcare programs serve those with persistent mental illness. Those are great assets to communities, but they need psychiatric intervention, and the staff needs special training on how to minimize the likelihood of confrontational situations, how to diffuse something that could become volatile, etc., how to communicate those who may or may not understand the typical course of how we speak to one another throughout the day. If you're serving diabetics, your staff needs to be trained on how to monitor glucose levels throughout the day. Your staff needs to be trained what it means to be a brittle diabetic, so they can perhaps be of assistance to someone who has insulin administered on a sliding scale. And so a physician involvement is good in your training process. Remember too, not every person who is elderly or disabled or who suffers from varying levels of dementia is entertained the same way. The same recreation is not appealing to everybody. I can recall games such as chair ring tossing, another game I call senior bowling, that many of my program participants really enjoyed, while others wanted to shoot me if I walked in front of the TV while the Jerry Springer show was on. The same differences in taste apply for people when it comes to diet and more. So a program that is truly comprehensive takes into consideration those varied needs. Now, in the business development kit with the manual on adult day healthcare that I've authored, I also talk about how to blend medical intervention, including certain specialties, to ensure that all of the needs of your program participants are met. I include in that something that does not cost you anything additional, a DVD entitled 25 Meaningful Activities to Make Your Adult Day Healthcare Program Serve Your Population Effectively. Let's go to item 2, building layout. You might be looking on this screen now and you see a sample floor plan of a roughly 3,000 square foot program. Your program may be larger, your program may be smaller, or your program may be in development and you haven't really decided how large you want it to be. But here are some key areas that you have to give attention to. You must ensure that the layout of the building really serves the intricate needs of each person enrolled. This includes ensuring you accomplish creating a barrier-free environment and an environment that provides privacy for naps, bathing, handling special medication issues, and more. I have visited programs where participants received infusion services from visiting home health agencies, which really provided a break for families. So you want a layout that accommodates all of this. I love programs with showers large enough for someone to receive bathing services even if they use a stretcher. It just does not matter. Being able to serve a multitude of people makes your program truly diversified, so make sure you get the floor plan right. The third item, and I know I touched upon it a little bit in the program development section, but the third item is serving special populations. Your program should be equipped to serve special populations and could serve multiple populations under one roof if the previous two elements are not ignored: comprehensive program design and the right floor plan. Now, special populations include whom? Let me isolate a few for you. It might be persons diagnosed with autism. It might be persons with neurological injuries. It might be those brittle diabetics, or it might be those who use oxygen. This would mean that you need to seek out training programs to ensure your staff is equipped to store oxygen correctly and to administer it, especially in the event of certain medical emergencies. You also need to ensure you can efficiently serve these individuals without ever being accused of being negligent. And to the extent that you invest in education, to that extent you will have an earning mechanism in adult day healthcare. But the program must be first and foremost not centered on what you can earn, but on the quality of services you render to those who are enrolled. And of course, your money is going to come from a variety of sources, and each one will have certain requirements attached to it. These three concerns, my friends, will contribute to the success of your program. Now, when you read the manual, which you can click from here and purchase for a special price right during this session, you'll obtain significant marketing advice, budgeting direction, advice on selecting the right business partner, and more. You can also enroll in a special mentoring program for as little as $100 a month, so I can assist you the next 24 months in making sure that you understand how the program can best be what I call retrofitted to serve the community where you plan to operate. You can always find me via the web at www.directcaretraining.com. I thank you so much for taking the opportunity to listen to what we've discussed today during this brief presentation. And I look forward to seeing you on that special mountain, the one I call the Mountain of Success.